Foods to avoid in pregnancy. Pregnancy is a wonderful time in a woman's life, but it also comes with a lot of responsibilities. It is a time when a woman's body is going through a lot of changes, and as such requires special attention in terms of diet. While there are many safe and nutritious foods that a pregnant woman can enjoy, there are also some foods that should be minimized or avoided completely as they pose a risk to both the mother and the baby. In this video, we will discuss 13 foods that pregnant women should avoid. Before we examine these foods, just a quick reminder that content in this video is for educational purpose and do not substitute advice from your doctors and practice professionals. Number 13. High-level mercury fish. According to studies, eating fish that contains high levels of mercury in pregnancy can cause developmental issues in unborn babies. Mercury is an extremely poisonous substance. Even low levels of exposure to it are considered unsafe, and it is frequently present in polluted seawater. Marine fish of a big size caught from such polluted waters can contain high levels of mercury. Excessive amounts of this substance can be harmful to your nervous system, immune system, and kidneys. Even low amounts of it could lead to severe developmental issues in children. To be safe during pregnancy and breastfeeding, it is recommended to avoid consuming fish that is high in mercury. Certain types of fish such as shark, swordfish, and king mackerel commonly found in such polluted oceans contain high levels of mercury which can be harmful to your developing baby's nervous system. It's important to keep in mind that not every type of fish contains high levels of mercury. During pregnancy, it is recommended to consume these varieties of fish. Safer fish options include salmon, sardines, anchovies, cod, tilapia. The next item on our list is raw or undercooked eggs. Though eggs are an excellent source of protein, raw or undercooked eggs can harbor harmful bacteria like Salmonella bacteria. This can cause food poisoning which can affect your baby. Eating food that has been infected with Salmonella can lead to symptoms such as vomiting, diarrhea, and intense stomach cramps. Severe cases of Salmonella infection in pregnancy can lead to significant outcomes such as premature birth, stillbirth, and illnesses in the newborn. Number 11. Organ meat. Organ meat such as liver should be limited or avoided because it contains high level of vitamin A type called preformed vitamin A. This can affect babies in pregnancy. Preformed vitamin A is a type of fat-soluble vitamin found in animal-based foods such as organ meats and fortified dairy products. It is different from beta-carotene, which is a form of provitamin A that can be found in plant sources. It is recommended to limit the intake of animal-based foods that contain high levels of preformed vitamin A during pregnancy to prevent the risk of birth defects and miscarriage. According to studies, consuming excessive amounts of preformed vitamin A, found in organ meat, or supplementation, particularly in the first trimester of pregnancy, can cause birth defects and loss of pregnancy. Number 10. Artificial sweeteners. It is advisable to avoid consuming food that contains artificial sweeteners such as saccharin, aspartame, and sucralose during pregnancy. These sweeteners have been found to be capable of passing through the placenta, and there is evidence linking their consumption to problems in pregnancy. According to research, consuming artificial sweeteners during pregnancy can have a negative impact on the growth and development of the fetus. It has also been linked to obesity, type 2 diabetes, preterm delivery, low birth weight, and metabolic disorders in babies. To replace sugar, it's important to opt for natural options such as honey, maple syrup, or agave nectar. Number 9. Unwashed fruits and vegetables. Fruits and vegetables that have not been washed may have harmful bacteria, parasites, and pesticides on them, such as E. coli, Toxoplasma, or Listeria. These can come from the soil or from handling them. Toxoplasma is a dangerous parasite that can be found on fruits and vegetables. Although most babies infected with Toxoplasma while still in the womb are asymptomatic at birth, there is a chance that symptoms, such as blindness or intellectual disabilities, may develop later in life. Additionally, a small percentage of newborn who are infected may have serious eye or brain damage present at birth. Number 8. Unpasteurized cheese and milk. Unpasteurized dairy products, such as cheese and milk, may contain harmful bacteria that can be harmful to both you and your growing fetus. These bacteria include Listeria and Salmonella, which can cause serious health problems, including miscarriage and stillbirth. Pasteurization is a highly effective method for eliminating harmful bacteria from products without altering their nutritional content. It is best to stick to pasteurized dairy products during this sensitive time in order to reduce your risk of contracting these harmful bacteria. Number 7. Excessively salty or sugary foods. One category of foods to avoid in pregnancy is excessively salty or sugary foods. Consuming too much salt can lead to high blood pressure, swelling, and dehydration, while excess sugar can lead to gestational diabetes, weight gain, and potential complications during labor. This can include things like processed snacks, sugary drinks, and excessively salty foods like chips or pretzels. While it's okay to indulge in the occasional treat, it's important to be mindful of your overall diet during pregnancy. Number 6. Undercooked or raw meat. Consuming meat that is not properly cooked, or is raw, can heighten the chances of getting infected by harmful bacteria like Listeria, E. coli, and Salmonella. It's important to cook meat thoroughly because, as many bacteria are on the surface of the meat, some may still be present inside the muscle fibers. Such infection can lead to complications such as premature delivery, miscarriage, and stillbirth. Therefore, it's important to ensure that meats such as beef, pork, chicken, or lamb are cooked to a safe temperature of 160 degrees Fahrenheit. The next item on our list today is high-caffeine foods and drinks. While caffeine is popularly known for its energizing effects, it can be harmful to the baby's health when consumed in high amounts. Due to how fast caffeine is absorbed and its ability to easily cross the placenta, high levels of caffeine can accumulate in placenta in babies since they lack the necessary enzyme to metabolize it. High caffeine drinks like coffee, tea, and soda can lead to restricted blood flow and decreased nutrient absorption in the placenta. The American College of Obstetricians and Gynecologists, ACOG, recommends that pregnant individuals should consume no more than 200 milligrams, mg, of caffeine per day. Number 4. Undercooked processed meat. Processed meats are those that have been treated in some way, such as through smoking, curing, or adding preservatives. These processes increase the shelf life of the meat but may also make it less healthy for you and your baby. Research has shown that consuming too much processed meat during pregnancy may increase the risk of premature birth, low birth weight, and even miscarriage. To avoid health risks, make sure to reheat processed meats like hot dogs, lunch meat, and deli meats until they are steaming hot before consuming them. So, it's best to err on the side of caution and opt for fresh, whole cuts of meat or other protein sources that are safe for you and your growing baby. Number 3. Raw sprouts. Raw sprouts are one of the avoidable foods in pregnancy. Raw sprouts, such as alfalfa, clover, and radish, have been known to contain bacteria such as Salmonella, E. coli, and Listeria, which can lead to food poisoning. Although cooking sprouts can kill these harmful bacteria, it's best to avoid them altogether during pregnancy to reduce any potential risks. Number 2. Undercooked or raw fish. Raw or undercooked fish, especially shellfish, can cause several harmful bacteria and viruses, such as Listeria and Salmonella. This includes sushi, sashimi, and raw oysters, among other types of seafood. These can lead to foodborne illnesses that could potentially harm both you and your growing baby. According to the Centers for Disease Control and Prevention, CDC, pregnant women have up to 10 times higher risk of getting infected with Listeria compared to the general population. Even if you're not showing any signs of illness, Listeria bacteria can pass to your baby through the placenta. This may result in premature delivery, stillbirth, miscarriage, and other severe health issues. It's recommended that pregnant women cook all fish thoroughly until the flesh is opaque and separates easily with a fork. Number 1. Alcohol. The American College of Obstetricians and Gynecologists recommends that pregnant women completely abstain from alcohol, as it can affect the growth and development of the fetus. Alcohol can harm the baby's brain and other organs, leading to long-term developmental issues. Alcohol should be avoided entirely during pregnancy as it can lead to fetal alcohol syndrome. Alcohol can harm the baby's brain and other organs, leading to long-term developmental issues. Alcohol should be avoided entirely during pregnancy as it can lead to fetal alcohol syndrome, FAS, is a series of physical and mental birth defects caused by drinking alcohol during pregnancy. FAS can result in lifelong impairments that can affect the baby's growth, facial features, organs, body structure, behavior, learning, and intellectual abilities. The only way to prevent FAS is to completely abstain from alcohol during pregnancy. The only way to prevent FAS is to completely abstain from alcohol during pregnancy. While it may be tempting to indulge in all of your favorite foods during pregnancy, it's important to remember that what you eat can affect your baby's health. Some foods should only be eaten occasionally, while others should be completely avoided. Thanks for watching and stay healthy.